Well, hello. Welcome everyone to the Thrive series. We're excited to welcome you back to the Fall 2021 series. If you've not attended a Thrive series program before, welcome. The Thrive program is a collaboration between mHealth Fairview and the Masonic Cancer Center at the University of Minnesota. Today is the last session of our fall series and a special tribute to Breast Cancer Awareness Month in October. Tonight, we will hear from a panel of experts on maintenance of bone health for those who have experienced breast cancer. Dr. Suzanne Trost, an endocrinologist at mHealth Fairview, will be speaking about bone health and fracture risk. Dr. Linda Kohler, a physical therapist in the Department of Rehabilitation Medicine, Division of Physical Therapy at the University of Minnesota, will be speaking on activities to improve bone health. Lastly, Kelly Scheller-Williams, oncology dietitian at mHealth Fairview, will be providing dietary suggestions for strong bones. So, all right, we're going to get started and let Dr. Trost take it away. Thank you.
Yes, hello everybody. So I'm glad everybody's here, and I want to talk about a topic that's very dear to my heart, my interest. And I want to start with an overview of fractures. So yes, advance, please. So the goal would be to understand the scope of the problem, to then quickly move towards thinking how to prevent fractures. So we differentiate the supplements that might be helpful for healthy bones, and be able to create a safe environment to decrease risk of falls, to describe also other lifestyle choices that are important for bone health, and also how to be confident how to take the medications for osteoporosis correctly. So fractures are quite common, which makes this topic really important. 1 in 2 women will have a fragility fracture throughout their life. Fragility fractures, or also osteoporotic fractures, are fractures that happen with little impact, also defined as a fracture with a fall from standing height, also called low impact fractures. So this topic is important in this group because certain cancer treatments actually increase the risk for fragile bones. But there are many other risk factors, like aging itself can also increase the risk of fragile bones and fragility fractures. Fractures can be quite a life changer. They can lead to disability. For example, after hip fracture, only 20% of people fully recover their pre-fracture abilities, and about 40% actually will need to go to more assisted living situations. So we're therefore as a risk that there's a change in lifestyle, and it also can go along with chronic pain. Next slide, please. So be aware of fractures. So most fractures we notice with pain and it's an acute insult. However, there are also some silent fractures that we have to keep an eye on. For example, vertebral fractures, if we have a fracture in one of these backbones, these vertebrae, actually half of them are silent fractures where we don't notice anything necessarily at the time of the fracture. So if you notice that you have a significant amount of sudden loss in height, that could be a concern for a spinal fracture. Next slide, please. And there is another fracture that's actually very rare. However, people who have been taking certain osteoporosis medications for many years, meaning more than 5 years, be aware of pain in the middle of the thigh that's kind of continuous, doesn't want to go away. It might be on one side or both sides. That could potentially be a sign of a very rare complications of osteoporosis medications. It could be that there's fracture in this long bone. So that's just something to also be aware. So in regards to risk factors for fractures, so actually having had a fracture is probably the largest risk factor to have another fracture. More so if it was a more recent fracture in the last 2 to 3 years. And then if there's a family history of osteoporotic fractures, that puts the person into a higher risk for fractures. Getting older, there's a way to measure the strength of the bone with a machine like this here, which is a bone density or DEXA machine. If the reads a low bone density, that would be an indication of higher risk for fractures. Again, certain medications, also prednisone, immunosuppressants, they increase the risk for fractures. Certain body habitus, being thin, actually is a risk for fractures. And then also being unsteady on feet, having falls, that's a fracture risk. And then there are more. So we are having going to see what we can do about these fractures risks. So things that are important are listed here. This include calcium, vitamin D, exercise, fall prevention, good nutrition, and then stopping to smoke. With that actually also stopping alcohol consumption. So we will hear in detail with the next presentations about exercise and nutrition. So I'm not going to talk a lot about those, but I'm going to look at the other things. Next slide. So calcium. So the goal of calcium intake is actually 1,200 to 1,500 milligrams of calcium per day. And that is between diet and supplements. Now, this is for all comers. Some people need more, but this is a pretty good goal. So there is calcium in diet, but if we have problems getting to this 1,200 to 1,500 milligrams, there are calcium supplements, and these are typically over the counter. And there are many different calcium supplements out there. However, the two most common ones are calcium carbonate and calcium citrate. So calcium carbonate, as such, this is the most common one, and this one needs acidity in order to dissolve and then be absorbed. The calcium citrate, in contrast, is water soluble. So people who take medications or over-the-counter medications that are suppressing the acidity in the stomach, like omeprazole, pantoprazole, famotidine, ranitidine, we think they should choose the calcium citrate because it doesn't rely on that acidity, which might not be there. And in general, we recommend to take calcium supplements with a meal. And in terms of how much to take, so pretty much the less calcium you get from your diet, the more you probably need to take calcium supplements. And some people might not need any. And some people might need to take a supplement 2 times a day or maybe even 3 times a day. The biggest side effect of calcium supplements are it increases the risk for kidney stone. So if you had a kidney stone in the past, probably want to be careful about making sure you're not taking too many calcium supplements, if any. Calcium in food, you cannot overdo the calcium in food. It's always safe, even if you had a kidney stone. So that is never a concern. Next slide, please. So the vitamin D. Vitamin D is the sunshine vitamin. We make it in skin that's exposed to sun. And there's really very little vitamin D in food. Vitamin D deficiency can occur during the winter, particularly in northern latitudes, so definitely Minnesota would be at risk, or when we avoid sun exposure. And also with aging, our skin tends to just make less vitamin D. So vitamin D supplements are typically over the counter. There are a few prescriptions, but it's pretty much the same. The FDA recommends 800 units for all people over age 50. And up to 4,000 units per day is considered safe. Some people might need more, particularly if there are absorption problems. And it's also recommended to take the vitamin D supplements, which typically are tablets, with a meal. Next slide, please. So safety is very important. This is pretty much talking about home safety. So when we set up our home, we want to make sure we decrease falls as much as we can. So we want to avoid clutter, we want to avoid throw rugs, loose cables. We want to mind the pets, cats and dogs that are running around. And good lights are very helpful, including night lights, so we see where you're going at night. Consider grab bars. It's definitely want to make sure you have those at the stairs, but also in the bathroom is a good place, in the shower. And then also beware of medications that might cause dizziness, like even over-the-counter medications could cause that, like diphenhydramine. So dizziness is not a good thing. Next slide, please. So this here is a picture of all the things we want to avoid. So you want to avoid clutter on the stairs, throw rugs, loose cables. This is probably not a good idea on the heater. You want to be really careful and mindful about the medications that we are doing. And here we see the cigarettes that we'd rather avoid. Also alcohol. Alcohol really is a toxin to bones. So one serving is usually what we would recommend to not take more than one serving if that's what you choose to do. And then also sedentary. So we recommend to get up, and you will hear more in the next upcoming presentations. And next slide, please. The other thing to keep in mind is to take good care of our health. So we recommend to see a dentist regularly, have those cleanings done if possible. So for once, we need our teeth to eat all those healthy foods we're supposed to eat. Teeth are also an inflammation, can affect the whole body, including the bones. And lastly, a lot of the medications that we prescribe for osteoporosis actually can affect the jawbone as well. So being up to date with dental care is the best assurance that the medications we give for osteoporosis are well tolerated. Next slide, please. This actually is the last slide. How to take the osteoporosis medications. So osteoporosis medications come in different forms. They come in tablets, and they come as infusions and injections. That's what we typically use. There are some other ones, but we would probably not use them in a setting like we are discussing here. So with the tablets, it's really important that they're taken on an empty stomach with a fairly good sized glass of water, like 6 to 8 ounces. Don't take any other medication at the time together with the tablets you take for osteoporosis. And try not to eat for 30 minutes, and you have to remain upright for 30 minutes. Fortunately, these medications are usually only once a week or once a month, so that makes it a little bit less difficult to do this procedure. We give the medication also sometimes as an infusion, and that would be for zoledronic acid, and it needs to be taken either every 6 or 12 months, depending a little bit where it's prescribed. There are different protocols out there. And something to keep an eye on when you get the infusion is that you really go there well hydrated. It's much easier for the kidneys to flush out the zoledronic acid with that. And then we have this other medication, which is an injection, and that's given every 6 months, the denosumab or Prolia. And that's usually in an infusion center. And what I want to stress with this medication, that really is something that needs very much to happen on time. So that should not be delayed for more than 6 weeks. And you should not just stop getting it. So if for whatever reason that medication is discontinued, it should have a follow-up treatment with something like either these here or these here. So just keeping those things in mind if you are prescribed with these medications. And then just one last slide for resources, if you just change once more. So if you want to see more information, which information is really important and great, knowledge is power. Some websites are better than others, so I would go to some official websites there, like the National Osteoporosis Foundation. There's a website from the NIH, which is very good. There's International Osteoporosis Foundation. I looked at breast cancer, and they now also have a good website, I think, Now Bone Health. And then close by, Mayo Clinic is always a great resource. They also cover bones, I think, really well. So that's the end of my presentation at this point. Thank you.
Okay, I think I'm up next. My name is Dr. Linda Kohler. I'm a physical therapist in the Division of Physical Therapy at the University of Minnesota. So next slide. So I'm not going to read through the objectives. Basically, I'm just going to go over the what, why, and how you can keep your bones healthy. And I'm coming at it from a physical therapy perspective. Next slide. So what activities can improve your bone health? Are listed here: weight-bearing activities, resistive exercises, good posture and body mechanics, all risk reduction strategies, and balance activities. And I'm going to go through these briefly during this talk. So these are just some ideas of what I'm going to be going over today. And I think it's important to know why it's important to do these activities. Otherwise, why do them, right? So with weight-bearing activities and resistive exercises, those types of activities can increase or slow down the bone loss. So with weight-bearing exercises, it helps stimulates the bone health, and enhances the bone growth just because of the weight-bearing part of it. The resistive exercises, the pull on the muscle against the bone, causes it to rebuild and become more dense of a bony structure. Balance training and fall risk reduction strategies will help minimize the risk for falls and fractures. And good posture and proper body mechanics are equally important because it can prevent that stooped over posture that can increase the risk of vertebral fractures because it puts a lot of stress on the front of the vertebral body and just can cause a lot of stress to the fractures and can help with balance too. So next slide. So these are some weight-bearing activities that are just examples of some things that you can do because like I said, weight-bearing activities are a great source to improve your bone health. Walking and hiking is one of the easiest weight-bearing activities. And just walking on a straight surface is great, but if you can vary what you're doing, so going over varied terrain at different speeds, with varying step lengths, doing different patterns, sideways walking, backwards walking instead of just forward walking. All of those type of activities, if you kind of just mix it up when you're doing your walking, it will surprise the bone and it helps stimulate the bone in on other areas. Whereas if you just go straight walking, but if you try to mix it up, the bone gets stimulated in different areas and is a little bit better. So walking and hiking and doing various patterns is great. The use of walking poles is even better. So when you're walking and hiking, you're basically weight bearing through the lower extremities. You get weight bearing through the spine when you're doing that, but not as much through your arms. So if you use walking poles as you're doing it, you're getting some weight bearing activity through your arms and your upper extremities too. Stair climbing is great. Yoga and Tai Chi is really good for balance exercises. Dancing also kind of surprises the bones and stimulates the bones in different areas because you're not doing the same pattern over and over. And impact activities, you want to be a little careful with that just because impact activities are good, but you need to be careful because it depends on your diagnosis and your activity level. Someone with osteopenia, so low bone density may be able to tolerate high impact, but just where somebody who has had more advanced osteoporosis would want to do more low impact activities. So impact activities is good for stimulating the bone, but you just need to be cautious with it and it needs to be individualized to a person's activity level and diagnosis. So I stress that with caution. Next slide. So resistive exercise, there's a lot of different things you can do for resistive exercises, body weight exercises, free weights, elastic tubing, gym equipment. I don't have enough time to go through all of these. I like to just keep it simple. So I like to encourage body weight exercises because you don't need any extra equipment to do them. You don't have to go buy a gym membership or, go buy some weights. Just using your own body weight is very useful. So just a couple examples, like the picture shows simple exercises, doing a wall push-up, just doing a push-up against the wall was really good. You're getting weight bearing through the arms, doing squats like the person on the upper, or on the top right, holding onto a chair, or maybe not holding onto the chair, whatever your activity level or whatever you can tolerate because of balance, or like the person on the bottom is doing a lunge. There's, like I said, numerous ways to get resistive exercises, and I'm only providing a few examples, but you need to do what's right for you. And I can't stress enough the importance of proper form, so you don't harm yourself, so you don't, increase your risk of getting a vertebral fracture. So posture is really in proper form. Doing the exercise is important, which brings me to the next slide. Talking about good posture and body mechanics. Like I said, it's very important. Having, just in the stooped over posture puts a lot of strain on the bones, especially the vertebral bodies that can lead to fracture. Being stooped over can lead to difficulty breathing too, just because it kind of closes down on the lungs, and can lead to poor balance and lead to falls, because if you are stooped over it, you lose your base of support and you can, more risk of falls. So you want to make sure you're sitting upright in your chair while walking or sitting. I'm sure just mentioning this makes everybody sit upright. I hope it does, because that's, we want to be interactive during these talks. So just, sitting upright, lifting your chest up, chin should be tucked in. Kind of think about balancing a book on your head. You should be able to balance a book on your head, or sometimes just thinking about a string that is, lifting you up, that's going through your body, so everything is all in alignment. So those are some things to think about when you're sitting and standing. Another good exercise to do, you can see the person in the middle picture there on the left-hand side. They are bringing their arms up to the side and squeezing their shoulder blades together. That's just another really simple exercise everyone can do right now. It shouldn't cause any issues with anybody. Just make sure your shoulders are staying relaxed when you're doing it. We call this the robber because it looks like you're getting held up. So it's just a very simple exercise, squeezing the shoulder blades together and just opening everything up in the front to help, expand the lungs and strengthen the back. And not just good posture, but good body mechanics is important too. And I'm just showing you here, make sure that when you're lifting objects, you're keeping them close to your body, because otherwise it puts a lot of extra strain on the back. Keeping it close to the body and lifting with your legs, not with your back, because again, if you have low bone density, that can increase the risk of fractures. Next slide. Dr. Trost already mentioned some of the things you can do to prevent falls. So I won't go through this very much, but so removing clutter, just trying to reduce any hazards in the house or anywhere that you're going. Removing rugs, repairing floor, just so that you're not tripping over anything. Storing anything that you are using frequently in a place that's easy to reach. So you don't want to have to be climbing on your chair to reach your plates, let's say, or your dishes of any sort. So making everything so that's easily accessible, so you're not having to climb ladders to get to it, because that's not very safe to be doing that. Using non-slip mats in the bathtub or shower, and just keeping things well lit. Next slide. Oops. So balance exercises can help reduce the fall, and as you can see in the pictures, and you can do these by hanging on to something if you are, if you do have balance issues, or you can do a more advanced exercise. These are just a few simple examples that I'm giving out. So Standing on one foot, like the person on the top left, you can work on standing on one foot for longer periods of time, or hanging onto a chair just to keep your balance and slowly taking your hand off the chair to see how long you can balance it. You can do it with eyes open, eyes closed. That's a little bit more challenging. Walking heel to toe, like the person in the middle on the top. This is also called a tandem walking. Brings you into a smaller base of support, which can be really challenging. Again, you can start with just holding the position, just putting one foot in front of the other and holding it without walking first, just to challenge yourself. And if that's too difficult, you might need to make a little bit further step forward. So there's different ways of doing it. Again, eyes open, eyes closed. The person on the top right is doing heel raises, just going up on their toes. I talked about knee bends already in a previous slide, and the person on the bottoms, we're doing repeated sit to stand, which can be very challenging. You can use your armrest to push yourself up, but if you can do it without armrest, that's a little bit more challenging. But if you do it repeatedly, it can be quite a workout. So just repeated sit to stand, and anyone is welcome to do it while we're talking right now. So that's great. Like I said, we want to stay active, and we're sitting here in front of the Zoom meeting right now. So guidelines to preserve your bone health. My biggest recommendation is just do what works for you. Everybody has, it's important to have your own individual plan and work out what works for you. Keep it simple, start with small changes and build on them. Doing a little bit is better than nothing. So don't feel like, that I haven't done anything today, so I'm just not going to do it. It's like 10 minutes of doing one thing during the day is better than nothing. The recommendations are to aim for 150 minutes a week of combined weight bearing endurance exercises and resistive exercises, trying to do weight bearing activities 3 to 5 times a week and resistive exercises 2 to 3 times a week. But again, start somewhere. Those are just numbers to try to follow. If you can do 10-minute increments a couple times a day, great. If you can do a full 30 minutes at a time, that works too. So whatever works for you, and just trying to squeeze it into your daily routine is I think I find easiest to do. So for instance, as we're sitting here at the Zoom meeting, just doing some sit to stand, you're getting a little bit of that weight bearing activity and some endurance, and while you're multitasking, listening to me right now. So try to squeeze in a little bit. It's better than nothing. Next slide. And how to take the first step. These are just some other things that you can try to do, incorporate into your daily life. So if you have a pet, or go on, like a dog, go on daily walks, go up and down hills, take longer walks than normal. If you are already taking walks, park by this parking spot away from work and at the store, which I always try to do. And I also try to take the stairs instead of the elevator at work. And I don't care how many times I take the stairs, I'm still huffing and puffing when I get to the top of the steps, but it tells me I'm getting a workout. So do squats while doing the dishes or while you're listening to me right now. Dance while making dinner or doing household chores. Surprise those bones by doing, dancing around, put on some good music. Do desk exercises. I just showed you the robber. You can do the robber a couple more times as you're listening to me. Do exercises like a wall push-up or something while you're listening to me, and do yard work or gardening. So there's a lot of different activities you can incorporate into your daily routine. Next slide. So in summary, to contribute to your bone health, you want to try to do weight bearing activities, resistive exercises. There's strategies to reduce your risk for falls, and proper body mechanics and posture is very important, and just trying to incorporate anything into your daily routine. And I know there's a wide spectrum of people listening to this presentation, and it's really important to make your exercise and activity level individual to you. And I would recommend seeking professional help, physical therapist, or some sort of community resources if you need guidance on an exercise program, especially if it's more advanced osteoporosis. We can help guide and provide a exercise program that's going to work for you and it's safe for you. So I do recommend seeking out help you have at least a general overview of some things that you can start working on right now. And I think I just have one more slide. And these are some resources you can use that have some great material. And I'm going to point out the very top one, Boning Up on Osteoporosis, is a really great, it's a brochure, but it's really a booklet that talks about osteoporosis. A lot of the things that we're going over today, it's just a wonderful resource for and a wealth of knowledge in there. So I'm going to point that one out, and there's some other ones that are listed here. So just some resources that you can look into for further information. And I think just one last slide is questions. So thank you.
Okay. Well, thank you, Dr. Frost and Dr. Kohler. I'm Kelly Scheller-Williams, registered dietitian for our Cancer Center at mHealth Fairview. And I sure did find myself sitting up straight and fixing my posture. So very helpful, Chris. Thank you. So today I'll be talking about a big important piece to our bone health, and that will be our nutrition. And next slide, please. So of course, as we know, the health and strength of our bones definitely relies on a balanced diet and a steady state of nutrition. So most importantly, we calcium and vitamin D, as Dr. Troth has mentioned. Next slide, please. And why are calcium and vitamin D so important? Calcium is so helpful in building and maintaining our bone strength. And it is the most important mineral for bone health, and it actually is the main mineral found in our bones. And vitamin D will play a role in helping the absorption of calcium. So it's so important to get that vitamin D to help that absorption of calcium to keep our bones strong. Vitamin D may also increase muscle strength to help improve or help prevent falls in older adults. Okay, so with the calcium, it's important to spread it out throughout your day, and try to, at least for every meal, include a high calcium containing food item. And I'll talk about what those foods are. And it's important to get calcium from whole foods rather than supplements. But as Dr. Charleston mentioned, for those people who may not get optimal calcium from diet or have specific medications or cancer treatment, maybe diet restrictions or diet sensitivities, we may not get enough from those whole food sources. So that's where supplements really play an important part in the health of our bones. Next slide. Okay, so the recommendations, give or take, but 19 to 70 age range would be about 1,000 to 1,200 milligrams per day, and of course even higher. 71 or older would need 1,200 milligrams per day or more, and of course taking up to 1,500 milligrams. I think maybe Dr. Chaucer mentioned 2,000 is unlikely to cause harm, still healthy. Next slide, please. Okay, so one of the main sources of calcium that we can get will come from dairy products: cheese, yogurt, milk, sardines. And actually the canned sardines usually have the bones in them. So the sardines, the meat or the fish of that product, the bone will reach into the meat. So that's why it's pretty high in calcium. And then also canned salmon is pretty high in calcium. Next slide, please. Your dark leafy greens also are high in calcium: spinach, kale, turnips, your collard greens, and then also green vegetables, broccoli, asparagus. So think green. You're going to get some good calcium from your greens. And then also fortified and rich cereals and grains. So total cereals, Raisin Bran, corn flakes. Looking at the label, if there's a label that says it's 20% or more of your daily value, that's a good source. And I want to mention with cereals, the vitamins and minerals, fortified nutrients are sprayed on cereals. So when you're having a bowl of cereal with milk, or if it's a milk alternative, you want to make sure you drink that milk from the bowl, because those vitamins are going to go off into the milk. So if you don't drink that milk, you dump it down the sink, that's where you're dumping all your vitamins and minerals. So be sure to drink the milk along with the cereal to get the optimal amount of calcium that it's meant for. And then you also get calcium from fortified juices. Mostly you'll see the common one is orange juice. So when you're choosing juices, definitely look for the ones that are fortified. So it's a quick and easy way to get some calcium as well. Next slide. Okay, so this is a little spreadsheet here of where you can find calcium, how much calcium per serving in what specific food. And you can see that right on the top, yogurt with fruit, low fat, 1 cup is about 345 milligrams. So that's pretty good. If you had, not that you're gonna have 3 servings of yogurt a day, but if you had 3 servings, you're gonna almost meet your daily calcium value with that, being at about close to 1,000 milligrams. And as you go down in the spreadsheet here, you see, for instance, kale, boiled kale, 1 cup is 94 milligrams. So well, these are good sources of calcium. And there's lists. You can go to the USDA.org website to get a specific list if you're interested in seeing the exact numbers in milligrams per the foods that you're eating. Next slide, please. Okay, and then what about vitamin D? So this again plays a major role in calcium absorption. So important to get this vitamin. It is this sunshine vitamin, as Dr. Frost had mentioned. And it is hard to get vitamin D, as you mentioned, also from foods, because foods aren't very high in vitamin D. Mostly the dairy products, there are a few others, but it is important to try to get it from the sun. But of course, as we know, we don't live in a climate, at least most of us don't live in a climate where we see the sun every day. And even then, so maybe our skin may not absorb it adequately. You have to actually have your upper body exposed for almost 20 minutes every day to get that optimal absorbency and the synthesized vitamin D. And then, so vitamin D also plays a role in, works with our parathyroid glands. So the parathyroid gland works to balance the calcium in the blood by communicating with the kidneys, the gut, and the skeleton. And when there's sufficient calcium in the diet and sufficient active vitamin D, the dietary calcium is absorbed and put into good use throughout our body. But if calcium intake is lacking or insufficient, and so is vitamin D, then the parathyroid glands will borrow the calcium from the skeleton, from our bones, in order to keep the blood calcium at a normal range. So important to see that those two vitamins and minerals are working together. Next slide, please. Okay, and then vitamin D recommendations, which Dr. Trost also mentioned, might look a little different, but it's roughly the same, at least 600 or more international units per day for the ages of 19 to 70, and then 71 and older, at least 800 international units per day. And then likely taking up to 2,000 to 4,000 international units a day is going to be safe. And some people need more. If people are deficient and have low vitamin D levels, less than 20, that's where it may be important to have higher levels, 5,000 or more international units of vitamin D daily, but always check with the doctor and endocrinologist, of course, and to see where you need. So important to get that vitamin D level checked, just to get a baseline and see where it's at, and just go from there. The winter months, as Dr. Truss mentioned, also, tend to be, you're going to be more deficient, so it's good to supplement in those colder months. Okay, next slide, please. So foods that might be rich in vitamin D, they have some vitamin D. You'll find in oily fish, salmon, trout, tuna, sardines, and herring, and then mackerel. Not, of course, as much as calcium, but these foods do have some vitamin D. Again, just harder to absorb. Next slide, please. Okay, you'll find vitamin D in egg yolks, red meat, liver, cod oil liver. I don't know many people that are going to eat a lot of the liver, cod liver oil, but there is some vitamin D in these foods. The fat soluble vitamins. So that would be option 2. And then the fortified breakfast cereals And fat spreads also will contain the vitamin D. But then again, with the fortified breakfast cereals, making sure you're drinking the milk from that cereal. Next slide, please. Okay, so what about other nutrients? Like nuts. Nuts contain some calcium, but they also offer two other nutrients that are essential for bone health, and that would be magnesium and phosphorus. Magnesium helps you absorb and retain calcium in the bones as well, and then phosphorus is a key component of our bones. About 85% of the phosphorus in our body can be found in our bones and our teeth. So there's some foods, a lot of nuts, seeds, legumes will contain phosphorus. That's also helpful. Okay, next slide. And then specific diets. What about specific diets, and what if you're following a vegan diet or a lacto diet? What can you do? Next slide, please. So the vegan and lacto vegetarian may be low in calcium and vitamin D. Vegan diets exclude all animal products, all animals. And so if you're not eating dairy products, the calcium and vitamin D may be low. But of course, the vegan diet, you're still getting some greens, so you're getting some good optimal calcium there. And of course, fortified products as well. And then the lacto-ovo vegetarian diet, this is a diet that will exclude all meats, poultry, and fish, but it does include the eggs and dairy, so you can get some calcium and some vitamin D in those diets as well. And so moving on to supplements. So supplements are very important if you have specific diet needs, diet restrictions, diet preferences, but you just want to be careful with supplements. They're monitored by the FDA, and you want to ensure that you have the USP symbol on there, and that's the next slide, so I'll jump down a little bit. But when you're looking for a supplement, always look for calcium with vitamin D, and most calciums will contain that, because again, that's going to help the absorbency. And the most common types of calcium, as Dr. Trost also mentioned, there's calcium carbonate and calcium citrate. And so you want to take the calcium carbonate with food, and it's okay to take calcium citrate on an empty stomach. And doing this will help with the absorbency. And it also may be a good idea to get a calcium, instead of getting a higher dose, like 750 milligrams or 1,000, it may be good to get a 500 milligram dose and try to split them up throughout the day, again, to potentially help the absorbency of the calcium, to split it up a little bit. Okay, next slide. Okay, so common brands that contain both vitamin D and the calcium, you'll see Nature Made, Citracal, Oscal, Caltrate. These might be familiar to you. But again, looking at that specific vitamin and making sure it has the USP symbol on it. So this indicates that the supplement has been tested to ensure that it does contain the ingredients listed on the label, and that it's pure from lead and other metals, and that it's dissolvable in your stomach. So a good way to test if you're a vitamin, and if you have calcium, vitamins, even a multivitamin, a good way to test them to see if they're going to be dissolvable, absorbable, is to put that vitamin in a glass of clear vinegar and stir it around frequently for about 30 seconds, a minute or so, and see if that dissolves. If it dissolves nicely, then you'll know that it's most likely going to dissolve in your stomach. Okay, so that's just a quick trick and test. Okay, next slide. So these are some great references that are recommended by our Academy of Nutrition and Dietetics and our oncology working group. So if you're interested, if you like reading and you're interested, I would suggest looking for the Whole Food Guide for Breast Cancer Survivors and the Whole Food Guide for Strong Bones. And I have the picture of these books here. The next slide, please. this is what the Whole Food Guide to Strong Bones looks like. And that's by Anne Marie Colvin. And you can get these on Amazon for about $10, $15. And then the next one is the Whole Food Guide for Breast Cancer Survivors. So both great resources. I know both our previous speakers have recommended resources as well. So there's just a plethora of information out there and to help support your health, your bones through nutrition, through exercise, and whatever it may be. So we're all here to support you, and these are so look for these resources. And if you have any other questions, of course, in terms of resources, I have a lot of information I can provide. Just let us know, let our clinics know, and we can help you out. So that is it from me. Thank you all. I appreciate you attending today, and yeah, let me know if you have any questions.
All right, thank you all to each of our speakers. I did want to comment about those resources that each of them provided. The slides will be on the website maybe by the end of the week. So if you want to refer back to the slides, they'll be there. I think, Kelly, we are going to start with you for the Q&A just because there were a couple of follow-up questions that came through the chat. One person asked specifically about fresh versus canned salmon. I think you had it labeled in your presentation as canned, but wondering if fresh offers the same amount of calcium?
Yes, fresh salmon is good. It's going to contain calcium as well. And if the canned salmon contains bones, that would be why it would be higher in calcium.
Great, thank you. And then there's another question about vitamin K. Is there some information you could add about vitamin K?
Gosh, not necessarily. Is this in reference to vitamin K and bone health, or is it in reference to the greens?
I think it came through just when you were talking about other minerals, vitamins and minerals, and she does say here in reference to bone health. So vitamin K specific to bone health, if there's any additional information to know.
And not necessarily. I can certainly look that up for you, but not that I'm aware of as a main nutrient for bone health. Mostly the vitamin D, the calcium, and then of course some other minerals like phosphorus and magnesium.
Thank you. One last question here about tofu. Wondering if you could address a little bit about soy for patients that have had ER positive breast cancer.
Yes, absolutely. So soy does contain a good amount of calcium. And what I would recommend for soy products, well, of course, in the American Academy of Dietetics, soy products are helpful even for ER positive. Studies have shown. So having 1 to 2 servings of whole soy foods per day, be it tofu, soybeans, soy nuts, those are all okay. The ones you want to limit or avoid are the soy protein isolates. So the concentrated soy that's coming from, protein powders that are soy-based, or protein bars that are soy-based, anything that has a soy protein isolate.
Great, thank you.
Yeah.
Dr. Kohler, I'm going to move to you. And I do believe, and I do have to comment, one of my favorite tidbits from your presentation was about surprising your bones by dancing. I like that. And I do think you addressed this, but just a question about how to exercise if you've had fractures and or have cancer in the bones. If you could just put one more, a couple of sentences around how patients should approach it with that, if they've got that history.
Yeah. So it depends on what bone is, fractured or where the bone metastases is. But you want to protect that. So if it is, you still can do some activities non-weight bearing. So if it's in the lower back or if you, as long as you have some sort of external stabilizer that can, help you with the weight bearing. So, there's, if it's a vertebral fracture, sometimes people are in the large TSLV braces, and that can help stabilize. But you can still do isometric exercises to help stabilize and help better improve the strength around those bones. So isometric exercise is a way to go about doing it. So it would really be dependent on where the fracture is. And if that's the case, I would just recommend going to see a physical therapist who can really individualize that and give a lot, not just give you a very individualized exercise program, but can give you pointers of how to protect it even more easy, even more. So if there's devices that, it might need to use an assistive device with a, stabilizing brace on the outside, and then be able to participate in activity, just because the brace and non-weight bearing would protect it more. So that's a hard question to answer, not knowing what is happening, but that's why I would recommend, probably seeing, a physical therapist who would be able to really understand the situation better.
Great, thank you. And I really appreciate that, keeping it safe, keeping both the person safe as well as that fracture safe. So thank you for covering that information. Dr. Trost, there was a comment that came in about Zometa. Is that something that either you referenced in your presentation or could spend a little more time talking about?
Yeah, I think the question was whether I spoke about Zometa. So Zometa is zoledronic acid. So that was that every 6 months or every year, once a year infusion. And I think it was mentioned that there was.
Yeah.
No, the regular telephone.
Okay.
Sorry, go ahead.
I think it was mentioned that it caused a fever, and indeed with that's actually something we see in 30% of patients who receive Zometa or zoledronic acid will have flu-like symptoms for a couple of days with the first infusion, and with the second infusion it's much less. It's only in 3%. So yeah, that's a very typical side effect that we see frequently, but fortunately only the first time around. Is that helpful? Did that answer the question?
Yeah, I think that was a great answer. Thank you. And then another question came in specifically about alendronate versus the generic versus the brand name. If you could talk about if one is better than the other.
Yes, so zoledronic acid recently became generic, which I think is just absolutely wonderful. It decreased the price by more than tenfold. So I think generics are, for the most part, with very few exceptions, a good thing. It just makes the medication more available. So that's usually what we use now for the infusion.
Okay, just a note quick to the audience that we are coming up on time, and feel free to chat in any questions or come off mute. One other question, Dr. Trost, that came in. This patient is experiencing early menopause, and what would be the right time for bone density screening for somebody experiencing early menopause?
So in general, we recommend a bone density 10 years after menopause. But under certain circumstances, we would consider it earlier. But typically, somebody has menopause at the normal age of 50, we recommend 10 years later. But if people have risk factors, then we would do it more at the time of menopause.
Good, thank you. Kelly, one question about what does the symbol look like, or if it's then US approved, what should people be looking for on that label to identify it as such?
That's a good question. The vitamin supplement should have the USP acronym on the label somewhere. It will say USP verified. So if it does say that, then you'll know that it was tested for metals, toxins, and so on.
Okay, everyone, we have just a couple minutes. Again, please feel free to chat in your questions to our panel of experts.
Dr. Trost, I was wondering, how often do you have to take or check a vitamin D and calcium level?
Oh, sorry, you're on mute. Thank
Okay.
you.
So that really depends. It really depends. As some people don't need it to have it checked. If your bone and if the vitamin D level has been good, you probably don't need to recheck it. Some people just don't seem to be at risk. If it's been very low, below 20, below 10, then it needs to be checked until it's where it needs to be, above 30. And then also keep in mind to just continue to take the vitamin D, because usually that's just something you're gonna need to take for the time being. You don't need to check it all that much, maybe once a year, but once the levels are stable, maybe every couple of years.
Okay, thank you.
And Kelly, there's one last question there in the chat about animal dairy products and safety for breast cancer survivors.
Yes, I believe so. They are the ones you want to avoid would be dairy products that contain hormones. So the dairy products that are, any product that's organic, animal products that are free range, you're going to get a better product, and they are absolutely safe.
Okay, thank you. With that, everyone, I just wanted to again express the gratitude to the panel of speakers for tonight's presentation, and also want to thank each of the participants for attending. And while this is the end of our fall series, we are very excited to share that our survivorship conference will be scheduled for Saturday, April 9th, 2022. That will be likely virtual this year, but please do mark your calendars for that annual Cancer Survivorship Conference. More details will be available soon on our email list. And you can sign up for that email list if you aren't already registered with that email that comes in tonight's survey email. And then also, as a side note, we are planning to resume the Thrive series in 2022 again. So please make sure you're on this email list to get those updates. And you can always find all of this information on our website, survivorship.umn.edu. To each of you, thank you so much for joining us tonight. And we appreciate all that you've done to make this session and the entire fall series a great success. Thank you. Have a good night.